Friends and Neighbors on the Fish, brought to you by Unity Catholic Federal Credit Union, good friends of ours and partners, and an opportunity to spotlight organizations that are making a difference. And our neighbor today is our neighbor here in Northeast Ohio, but also they connect us with neighbors in another part of the world in Central America. Kathy Chig from Camo, that is Central American Medical Outreach.
Correct.
I knew I had it right. What is Camo?
Well, Camo came out of my Peace Corps experience from 1979 to 1981. And during that time, I was one nurse of 4 nurses that took care of 210-bed hospital with 2 people per bed. So during that time, I just saw incredible death because there was no equipment in the hospital. And so if somebody needed suctioned, if somebody needed a ventilator, all you could do is sit there and help them breathe the best they could and watch them die. So that experience was just devastating to me as a young RN. And so I came back home, wanted to forget the experience, had reoccurring dreams from 81 till 89 of going back to that hospital and waking up in different areas of the hospital in my dreams. And so in 89, I did go back because I thought, well, what is God trying to tell me in these dreams? So I went back, and when I walked in, conditions were worse. And that literally took me to my knees, and so that brought me to the point of coming back to the States, going back for my business degree, and then starting Camo in 1993. It was incorporated. And so now, you know, this last year we served 174,000 people in 26 medical programs. We shipped 9 containers a year. And we built a women's shelter. Also, we have built the trade school. We have a daycare center, a community center that sees 600 children. Second largest healthcare center in Honduras that sees 800 patients a day. So out of that dream came a lot of people that are also supporting and creating miracles every day, and really boots on the ground serving people.
And we're Northeast Ohio proud because you're located or headquartered right here in our area.
In Orville, Ohio, the Smucker Jelly Place.
Yes, the Smucker Jelly Place.
Gotta be sweet there.
You have to be sweet. Summarize the smiles, the difference you make. These are the poorest of the poor, but they're just like my family, just like your family. They just need some help. Maybe you're watching and you're saying, wow, that's a big vision. That's the type of thing I would like to be involved in some way. So we have all the information here on the screen so you can do that. The website's really easy too, right? It's camo.org?
Yep.
Okay, I've got the big questions, but Kelly from Unity Catholic Federal Credit Union, she always has the big check. Okay, so Kelly, why don't you come on in?
Kelly?
Big check.
Thank you, Kelly,
So just a check to say, let's keep the good work going, okay?
Thank you so much for
right.
doing this, and thank you and your organization for helping.
Kelly, we have so much fun with the Friends and Neighbors program, and you never know where we're going to wind up. Today, a local organization right in Orville, Ohio, that's helping people in desperate need in another part of the world.
The work that Kathy is doing has been truly led by God. You know, dreams are nothing to laugh at. Everybody has them, but to be able to follow through and create the impact in these people's life is just amazing. We thank you for your follow through. I think that's follow through, you know? Unity Catholic focuses on financial wellness for all, and this is just a small bit in your bucket of need, but we really enjoy being the partner.
Well, the good news is Kelly has ordered another giant checkbook for the coming year. So if you know of an organization that you feel should be spotlighted with our Friends and Neighbors program, just go to the FISH website and click the link. It's Friends and Neighbors with Unity Catholic Federal Credit Union and the FISH.
One person and one duffel bag began the story of Camo.
As a nurse, I had to wear white shoes during this time, and I lived 1 block from the Central Park where they had shoe shine men, and 4 blocks from the hospital. So I'd walk every day to that shoe shine park, and or to that Central Park. And Don Chepe was a man who always shined my boots. And one day he goes, "Kathy, can I shine your white shoes?" And I said, "Well, Don Chepe, all you have is brown polish and black polish. I mean, you know, I have white shoes." "No, I bought white polish. I want to shine your shoes." So for a year we had this agreement that he would shine my shoes once a week, and he did that. Well, on Christmas I received a sweatshirt from my aunt, and so I had 2 sweatshirts. And Don Cheppy, in the mountains, it can get down to 45, 40 degrees. It's really very cold, and he only had a little thin t-shirt that was frayed. And so when I got my shoe shines, I thought, I'll run down and get my extra sweatshirt, give him a sweatshirt. It's Christmas, it's around Christmas, you know, I'll feel, this is great. He needs a sweatshirt. So I defined Cheppy's need, that he needed a sweatshirt. Ran down, gave it to him, very gracious, put it on, happy as a lark, because he had this sweatshirt. But the next week I went, Cheppy wasn't there. And as I went through the park every day, Cheppy wasn't there. So when it came time for my shoes to be shined, I stopped and I said to the other guys, Don Cheppy, where's Don Cheppy? And they go, Kathy, that sweatshirt that you gave him, well, he sold it. And then he bought pure cane alcohol, and he drank all of that. And Don Cheppy drank himself to death. He died. Now, why do I tell that story? I tell that story because it's very depictive of how we as Americans feel that we can define other people's needs. We cannot. We cannot do that until we have that relationship with people. And you need to invest your time, not your, money helps, but it's that time investment that you need to do to get to know other people. And in mission or in community development or in medical development, you need that relationship. And through that relationship, you start to understand the need, not how you view it, but the need of how they're viewing it. And once you understand the need of the other individual, you can create programs that have some sustainability to them. And you can create that synergy because now you're working together as a partnership to do something, and you're not telling the rest of the world what they need.
The model was developed in 1993 and is still thriving 30 years later. The first decade was about building infrastructure and saw the development of the counterpart model in 13 medical programs. Specialists from the United States were paired with specialists from Honduras, and training was applied to short-term missions growing rapidly. First ophthalmology, dental, biomedical, then audiometry and prosthetics, filling gaps of service. But without the tools, it couldn't be done. Kathy's years as a nurse provided valuable connections to the medical community in Northeast Ohio as she secured donations of refurbished medical supplies. Soon a duffel bag full of donated medical supplies packed in Kathy's living room grew quickly to such a large quantity of supplies and equipment that an abandoned warehouse and barn storage spaces were donated and then dispatched to Honduras. By the end of this decade, 6 53-foot semi-trailer truckloads of supplies and equipment were being shipped annually to Honduras. The infrastructure of the hospital of Santa Rosa de Copan was unsanitary and inefficient. It had torn rubber gloves laying in the sun drying, x-rays hanging on trees, and linen drying in the courtyard. The water was trucked in from the river in open barrels, and a kitchen was so filthy that the walls were literally black from the open fires that cooked the food. In the 90s, hospital employees were still cooking with wood and washing clothes by hand, so improving these facilities was urgently needed. Soon, a modern kitchen and laundry replaced the rat-infested, smoke-filled rooms where these services were provided for 210 patients a day. Camo had grown so rapidly that it could no longer function from Kathy's house or on her nursing wages. So she quit her job in February of 1998. 6 months later, Hurricane Mitch hit, leaving devastation in its wake. Camo was asked by the USA ambassador to lead the Crisis Corps effort. It lasted 16 months. Camo assisted in 3 cities with cleanup, restoring water systems, and building temporary homes. Supplies and donations increased, and the need for physical infrastructure in the USA was vital. Land, materials, and labor were donated, and the Camo USA facility was built in Orrville, Ohio. In the final year of the first decade, Camo also built corporate headquarters in Honduras, again on donated land in front of the Hospital Regional de Occidente. By the end of the first decade, Camo had grown to 13 programs, serving 35,000 people per year. Camo had 13 employees, 3 in the USA, 10 in Honduras. With a physical structure in both USA and Honduras, Camo was taken more seriously. All the programs continued to serve the people of Honduras, and the counterpart model was thriving, with doctors and dentists traveling from the USA to Honduras several times each year. The warehouses were filled with a constant flow of supplies and medical equipment from across the United States. Requests started coming in from community leaders concerned about the children and gangs. The first request was for public daycare. Camo intervened with medicine, food, a full-time teacher, and improvements to the facility. It was obvious to the community that Camo could get projects completed, so the mayor of Santa Rosa de Copan asked for assistance to complete an abandoned building with no roof, just the walls, for a community center and gym. Camo responded and brought it from mud to completion. Today, more than 400 children and adults per day use this facility. Seeking sustainability, a for-profit medical sales and services company was developed in Honduras, with all the revenue generated going into the services of Camo. The company, called the Social Investment Association, started to produce revenue streams and increased its ability to cover operational costs by 5% per year. Another facility that was abandoned was the Trade School of Santa Rosa. The president of their board turned to Camo to reform the board and develop the school. By getting young, successful Honduran professionals on the board, we were able to bring life to an abandoned building. With trade equipment being donated from the USA to get the trades up and running, within 4 years, that school was graduating 900 students per year in 16 different trades. A second request came from the community, many agencies, and the mayor of Santa Rosa to build a safe house for domestic violence, which is the leading cause of death of women in Honduras. The 5-year project was completed, and from day one has provided for victims and has seen a constant flow of women and their children. During the second decade, Camo continued to assist with infrastructure improvements of the hospital, with the new electrical system, generator, phone system, medical compressed air, new pediatric unit, new emergency room, trauma room, endoscopy suite, and X-ray department. In the second decade, Camo grew from 13 programs to 16 programs, serving 107,000 people a year. Camo was sending 8 semi-truckloads of medical supplies per year and had increased from 13 to 37 employees in its Honduras headquarters. Standing strong in a decade of adversity. Over the years, Camo had many requests for assistance from the director of the largest public health clinic in the west of Honduras, serving 180 patients a day. The electrical, water, and sewage systems had collapsed. The walls were cracked to the foundation, and the cement roof was caving in on the patients. It was time to turn attention to this public health center. After 2 years of construction, the facility was inaugurated with full services of a laboratory, pharmacy, X-ray, mammography, ultrasound, and treatment for cervical cancer. It has 22 clinic exam rooms and 2 training rooms. It provides over 800 services a day and is the second largest clinic in Honduras. Not only was Camo involved with physical infrastructures, but has also provided education on standards of care. Camo became the national registry for Honduras under the American Heart Association. The procedure manual that Kathy had written in Peace Corps in 1981 was recovered and revised to become the first nursing procedure manual in Honduras. Now the manual is being used in the private university and in many of the hospitals in the western part of the country. For more than 20 years, the girls' orphanage was flooded with sewage water in the kitchen and laundry when it rained. Both these areas were rebuilt with an addition of a computer lab serving 60 girls aged 6 months to 18 years old. The trade school, by 2015, had grown to the point of needing expansion. Now, with additional space, more courses have been added, providing more job opportunities to the youth of Honduras and their future families. Leading Camo sustainability, our Social Investment Association was producing revenue that would provide payroll for all our employees during COVID. Camo became the only nonprofit organization in Honduras fully functional during COVID, managing $2.4 million of World Bank funds for COVID testing and treatment of patients. As COVID was raging, people were isolated in their homes. Hurricanes Eta and Iota bore down on Honduras within the first 2 weeks of November 2020. With no vaccines available, people were forced to live in close quarters. Camo led the response to Eta and Iota, building 443 homes for the families who were displaced and filling 1,000 buckets with household necessities. At the close of the third decade, Camo provides specialty care to rural communities with 2 Honduras medical teams per week traveling to rural areas to provide dental and medical care. The USA counterpart model is going strong. Our first counterpart in ophthalmology has the largest eye center in Honduras, and at the end of this decade will become a training center for the residency programs in ophthalmology for the country of Honduras. Improvements continue at the hospital, with it being upgraded from a regional to a national hospital due to infrastructure provided by Camo for the past 30 years. The Minister of Health approved Camo as the model of equipment management in the public hospital, where Camo built a new biomedical maintenance department with not only physical infrastructure, but also the protocols and education that parallel the model. In 30 years, Camo had grown from 16 programs to 25 programs, serving 99,000 people directly per year and an unmeasurable amount of people indirectly. We continue to send 8 semi-truckloads per year and have increased from 37 to 60 employees in Honduras and 4 in the USA. For 30 years, Camo has kept its administrative overhead under 5%. It is not possible to adequately convey all that Kathy has accomplished through Camo, but those of us who've been there know a little bit. From a one-woman show taking on the dated and inefficient system, from local physicians to the politicians in Tegucigalpa, Kathy has built an organization that commands the respect of the entire country, bringing people into the model of Camo one by one, turning a duffel bag into a dream of providing hope to the forgotten. Today it is an organization of not one, but many, by faith with no boundaries. We are grateful to all. To participate in our $30 for 30 Years campaign, go to www.camo.org/donate.